Well, the last thing we need with rising COVID infections is a strike in the healthcare sector. Gauteng's emergency medical services are accusing the health department of exploitation. They say they're overworked and underpaid. They've marched to the offices in Johannesburg to hand over a memorandum. They want payment for extra hours worked. The department has been given 2 weeks to respond. Otherwise, workers say ambulances will not respond to emergency calls. Lindokuhle Xulu reports.
Medical workers have handed over a memorandum of demands to the Department of Health in Gauteng. Among their demands is the compensation for working long hours. Out of their ambulances to the streets, these emergency medical services workers say they are being overworked. And while they are willing to go the extra mile to save lives, they demand to be paid for it.
The overlapping hours, the hours and access, they should be paid as overtime. So the main priority is that we demand our money.
Workers say while they are supposed to work only 160 hours per month, they are currently working over 190 hours. They blame this to the health department's refusal to hire extra staff.
We are under pressure. We are working more hours. We are not being paid. We've got a lot of people who are qualified to be medics. We've got a lot of ambulances that are just standing, but people are not being employed.
Issues of safety have also surfaced during these demonstrations. Workers say the department hasn't done enough to protect them as they respond to calls.
A few days ago, one of our crews were shot, and all they do is just to send memorandums to the bases, and they do nothing about it.
We want people to have access to their offices. There's no problem.
After arriving at the department, a memorandum was read and handed over. 2 weeks has been given for the Gauteng's health department to respond in a manner that these protesters say should be positive or face a total shutdown. Lindokuhle Xulu, Johannesburg.